Hi, my name is Michelle Embleton, and today we're going to have a look at what is fertility preservation. When and why would I choose to preserve my fertility? What are the preservation techniques for women, fertility preservation techniques for men, and we're going to have a look at how much can these techniques cost. We're then going to have a look at a couple of the most frequently asked questions and answer them for you. Well, there are two main areas in which to think about fertility preservation. The first is for cancer patients. The treatments for cancers, such as radiotherapy or chemotherapy, tend to be very aggressive and can affect or perhaps destroy the precursor cells which produce sperm or indeed the eggs. This will obviously lead to problems in fertility. The idea is to then take a sample of the eggs or the sperm and freeze them before the cancer treatment so that they can be used at a later date in an assisted reproduction treatment if the patient is now healthy and chooses to have children. Another reason to use fertility preservation is due to the changes in our modern society. Modern life is quite hectic with its economic restraints, and more people are choosing to become parents at a later age. Unfortunately, as you age, your fertility declines. If you are thinking about having children later and you want to delay parenthood, it's a good idea to consider fertility preservation so you don't have any fertility issues in the future. We can actually think about fertility preservation as people becoming their own egg and sperm donors for future use, for their future selves. So if in the future you choose to have children when you didn't when you were younger, you have donated your own eggs and own sperm for your treatments. There are several reasons why we may wish to preserve eggs or embryos, and these could be due to a cancer treatment, for example. You may want to freeze your eggs before a cancer treatment to preserve your fertility for the future. For delaying motherhood, our socioeconomic conditions mean that many women are choosing to become mothers later in life, or perhaps you know you have a disease which affects your ovarian reserve, such as endometriosis. In these cases, we would want to have a look at how can we preserve your fertility for the future. One option is egg vitrification, which involves the ultra-fast cryopreservation of your egg cells, which will then be stored in liquid nitrogen until you require them in the future. The main advantage of egg vitrification is that it can maintain the quality of your oocytes. They have good survival rates following the freezing and thawing process. In order to perform egg vitrification, the woman first needs to undergo ovarian stimulation. Hormonal medication is administered to develop several eggs at once. When this will be monitored by ultrasound, and when the woman has her eggs developed, they will be collected in a surgical procedure of egg retrieval. When the eggs have been removed from the body, they will then undergo the process of vitrification. Vitrification involves the very fast freezing of the egg cells using cryoprotective agents to prevent ice crystals forming inside the eggs, and therefore they have very good survival rates. This fast freezing is down to minus 196 degrees centigrade, and then they will be stored in a special straw structure in a vat of liquid nitrogen where they can remain for many years without undergoing any kind of degradation. When the woman is ready to become a mother, she can use in vitro fertilization techniques. The egg will be thawed, fertilized in the laboratory, and transferred to her uterus with the aim of producing the pregnancy. An alternative to egg vitrification, or freezing your eggs, is freezing your embryos. The same kind of cryogenic process is used, but the difference here is instead of freezing the egg cells, the eggs will be fertilized first in the laboratory with the man's sperm, and the resulting embryos cultured for a few days to allow them to develop. The embryos themselves are then frozen. Obviously, this technique is more suitable for a heterosexual couple who are in a committed relationship who plan to have children together in the future. There is also a process known as ovarian transposition. In this process, the ovaries are surgically removed and transposed to another part of the body, where they will be stored with the adequate blood supply to maintain their integrity. This is done when perhaps the patient is going to undergo radiotherapy or chemotherapy in the area of the ovaries. By placing them out of reach of the treatment, you are preserving your fertility. They can then be put back into their proper position later on in life when the cancer has been cleared. The experimental technique of freezing ovarian tissue is an idea for preservation of fertility for girls before puberty who may have to undergo a cancer treatment. As they have not yet got to puberty, their eggs won't be developing in their ovaries, so the normal process of ovarian stimulation cannot be carried out. In this treatment, a small slice of ovarian tissues, which contains all of the follicles which will be responsible for developing eggs in the future, will be removed and stored and vitrified and stored in liquid nitrogen. At a later date, this ovarian tissue, when the cancer has cleared, can then be placed back into the body, perhaps in the ovaries or maybe in another location, with the aim that the girl in the future, or the woman now, can achieve pregnancy. To preserve male fertility, we have the very good technique of sperm freezing. There is also another experimental technique of testicular tissue freezing, which we'll have a look at in a minute. The most obvious reason to freeze your sperm for fertility preservation is if you are going to undergo a cancer treatment. However, these are not the only reasons to freeze your sperm. Other reasons to freeze your sperm may include patients who are planning to undergo a vasectomy. If you are going to undergo a vasectomy, it's not a bad idea to freeze a sample of sperm in the future in case you do decide in the future you want to have children and you can resort to using your frozen sperm. Also, in cases of poor sperm quality or perhaps poor sperm concentration, freezing the sperm allows you to bank a sufficient quantity of sperm for future assisted reproductive treatments. In treatments such as IVF, a sperm sample is required on the day when we are going to fertilize the eggs with the sperm. Sometimes this pressure may mean that the man cannot produce the sample. In this case, we can resort to a previously frozen sperm sample. Sperm freezing is also used to store donated sperm. And also in the cases of transsexuals, when a man wants to transition to become a woman, it may be a good idea to freeze a sperm sample first in order to preserve your chance of becoming a parent in the future. In order to perform the process of sperm freezing, there is no hormonal medication or previous preparation required, other than maintaining a period of sexual abstinence of between 3 to 5 days before giving the sample to ensure the sperm is of the very best quality. When the sample has been received, it will be analysed in a semen analysis and processed in the laboratory so that the very best of the sperm is cryopreserved. It will be frozen in liquid nitrogen with cryoprotectants where it can be stored indefinitely. The experimental technique of testicular tissue freezing is designed for the fertility preservation of pre-adolescent boys who may have to undergo a cancer treatment. As they have not yet reached puberty, they are not able to give a sperm sample. To do this, a thin strip of testicular tissue containing the germ cells, which are the ones which eventually become and produce the spermatozoa, will be removed and cryopreserved. In adulthood, when hopefully the cancer is now gone from the body, this testicular tissue can be returned back to the body and spermatogenesis will hopefully take place. The cost of fertility preservation depends on the complexity of the treatment. The most simple procedure here is freezing sperm. And generally, depending on your clinic, you can expect to pay about $1,000 to $1,500 in order to cryopreserve your semen. You may have additional costs every year for the continued storage of your sperm. Egg and embryo vitrification is a much more complex and laborious procedure, and this is reflected in the price. Again, depending on the clinic you choose to use, freezing your embryos may cost approximately $12,500, whilst freezing your eggs between $10,000 and $11,000. Added to this, you need to think about the cost of storage. The first year of storage is usually included with the vitrification process, but each subsequent year you will have to pay storage costs, which are usually around $600 a year. Another factor in this is the medication you have to use for the ovarian stimulation to produce the eggs in the first place. And this can be from $500 to $2,000 depending on the particular medication that has been prescribed. Now we're going to have a look at a couple of the most frequently asked questions that our users have. At what age should I preserve my fertility? The most advisable age in which to preserve your fertility is under the age of 35. As a woman gets older, the quality and quantity of her eggs decreases. And this is especially true after the ages of 38. From that age onwards, the decline is quite rapid. Eggs from older women can also tend to have more genetic or chromosomal abnormalities, which makes them less likely to be successful in future IVF treatments. The earlier, the better if you are thinking about preservation of your eggs. I'm over 35. Should I freeze my eggs or my embryos for future use? If we answer this question from purely a technical point of view, it would be that eggs are more fragile than embryos, and in the process of vitrification it may be that more eggs are lost than would be the case for embryos. As such, from a technical point of view, it is better to freeze embryos than it is to freeze eggs. However, if we are looking at this question from the point of view of the patient and IVF treatments, we need to think about why the woman has chosen to undergo fertility preservation. When you cryopreserve your embryos, you need to keep in mind that your personal situation may change in the future. If a heterosexual couple decides to freeze their embryos for future use, it may unfortunately be the case that that couple later on are no longer together, and hence what happens to those embryos that belong to both of the couple. In the case of single women who have chosen to preserve embryos using donor sperm, it may be the case in the future they meet a man with whom they wish to have biological children, but this will not be the case as she has frozen her embryos, which have already been fertilized, and not her eggs. In short, embryo cryopreservation may be technically the better technique for women over 35, but it doesn't prevent any future possible problems due to a change in the woman's social situation in the future. We want to hear about your experiences, so please, if you have preserved your fertility or are thinking of doing so, please leave us a comment below. We hope you have liked this video and found it informative. If so, don't forget to click like and subscribe so you don't miss any of our future videos. And if you would like to read a little bit more in detail about this, I leave you with a link to the article below in the description.